Good afternoon, everyone. My name is Taylor Wells, and I'm the PGY1 community-based pharmacy resident at Cape Fear Valley Health System in Fayetteville, North Carolina. And today I'll be talking about the feasibility of implementing point-of-care influenza testing and Oseltamivir dispensing in our outpatient pharmacies. I have no financial disclosures for this presentation. Here's a little bit of information about our health system, and just to let you know, I will be going through some of the background information rather quickly due to the new time constraints. So we do have one of the busiest emergency departments in the nation, and we do have the busiest emergency department in North Carolina. So we're always looking for ways to reduce our ED visits and lower healthcare costs. Point-of-care testing is kind of a new concept to outpatient pharmacy. So a lot of retail pharmacies are doing this across the nation as a way to increase profits and combat those declining reimbursement rates. In some states, have even passed laws that allow pharmacists to dispense medications as a result of what some of these tests show. And so the National Association of Chain Drugstores actually offers education and certification for the process of implementing point-of-care flu testing in the pharmacy. And so in North Carolina, we can do point-of-care testing, but there's currently no legislation on prescribing based on the test results. Two studies were completed previously to demonstrate the importance of point-of-care testing. They really highlighted the readiness of community pharmacists to participate in the management of patients with influenza and their ability to actually implement this into pharmacy workflow. It also showed that pharmacist point-of-care testing helped reduce the delay in initiation of treatment and decrease the need for additional clinic visits and hospitalizations. So point-of-care testing has many benefits, such as allowing patients to have better access to testing and treatment. It also helps reduce those ED visits and the ER wait time, as well as reducing exposure to critically ill patients. So the purpose of this study was to determine the feasibility of point-of-care testing and protocol-driven Oseltamivir dispensing in an outpatient health system pharmacy, and to evaluate the potential cost savings associated with implementing this service. So what we asked was what percentage of patients visiting the ED with a diagnosis of the flu would have qualified for protocol-driven rapid flu testing and Oseltamivir dispensing at our outpatient health system pharmacy. So the primary objective, we evaluated this by looking at the number of patients who visited the ED for the flu during the 2018-19 flu season that could have qualified for flu testing in our outpatient pharmacy based on a protocol that we previously established. We also wanted to look at the cost savings that this would have resulted in. And so for our methods, this was a single center retrospective review feasibility study with no comparator group. It was completed at Cape Fear Valley Medical Center on patients who visited the ED from October 1st, 2018 to May 1st, 2019. Patients were included if they had a diagnosis of the flu and were 12 to 70 years old. They were excluded if they were pregnant, breastfeeding, allergic to Oseltamivir, had a diagnosis of pneumonia in the previous 4 weeks, or a recent documentation of a live influenza vaccine. And so subjects were identified using flu-related diagnosis codes, or J codes, and then they were screened for inclusion-exclusion. Those who were included in the study were then screened for eligibility for outpatient point-of-care flu testing based on our predetermined protocol. We collected basic patient demographics such as the gender, age, height, and weight, vitals, and measures of clinical stability, immune system status, if they had other respiratory conditions like asthma or COPD, what their symptom presentation was, and then how long ago the symptoms started, as well as any drug allergies. Our primary endpoint was the number of patients who qualify for the testing, and our secondary endpoint was the difference in cost if these patients have been tested in the outpatient pharmacy rather than the ED. 1,955 patients were screened. 1,504 of those were excluded, mostly based on age. Much of them were much younger, and that left 451 charts for review. The average age of patients included in the study was 30 years old, with just slightly more females. And as you can see, for our primary endpoint, only 49 out of 451 patients actually qualified based on our protocol, which we were really bummed to see. But we started to evaluate why they didn't qualify and noticed that this was largely due to the vital signs. So 343 patients were excluded for vital signs, and 281 of those were excluded due to having a temperature of less than 100.4 degrees. And this was mostly because they had taken antipyretic medications prior to their ED visit, which lowered their temperature. And then for our secondary outcome, we evaluated it using a CPT code of 99283, which is the publicly listed amount Medicare will reimburse for a level 3 complexity ED visit in North Carolina. That amount is $64.53. This information is available on cms.gov in the physician fee schedule. So we use this to compare to the cash price that we would have charged at our outpatient pharmacy, which was $30. And so even though we only had 11 patients that qualified for the point of care testing, there was still an estimated average saving of $379.83. And this cost also doesn't include the cost of the actual flu test in the hospital. So it's really an understatement of how much was saved. And so the biggest limitation of this study is that it was a retrospective review. And so we were missing a few data points as far as vital signs and patient symptom presentation. But in conclusion, outpatient point of care influenza testing is not feasible at our outpatient pharmacies based on our currently written protocol. Further revisions need to be made to our protocol before we can reassess the feasibility of offering these services. And so we would like to look further into this, especially since the point of care testing for influenza appears to have a great amount of cost savings. So for our health system, just with those few that qualified, it was nearly $400. And so for the self-assessment question, which of the following is not a barrier to implementing point-of-care influenza testing and protocol-driven Oseltamivir dispensing in an outpatient pharmacy? So you have regulatory and legislative variants, ability to obtain a CLIA waiver, deficits in pharmacist training and education, and limited implementation of point-of-care testing services, which results in stakeholders failing to realize the potential benefits. And so the answer is actually B. So obtaining a CLIA waiver is fairly easy. The biggest hurdles we faced were the lack of legislation allowing for prescribing medications based on the results of the testing. And then these services have to be offered as cash pay only, and they're not billable due to stakeholders failing to realize the potential benefit. And so I would like to thank my co-investigators and Cape Fear Valley Health System for all of the time, effort, and resources they put into this study. And my email is at the bottom of the slide, so please feel free to reach out to me with any questions.